A warm welcome to this talk. Now, basically what I want to do today is play you some clips from the recent speech by Robert Kennedy Jr. on what is basically the health crisis in the United States, and other countries like the United Kingdom aren't that far behind. We are suffering from an epidemic stroke pandemic of preventable diseases. And this is kind of what we're looking at the moment. This is related to lifestyle. It's also related to inappropriate medical interventions. And it's related to the way that the larger influences, the corporate influences, the national influences, the corruption, the international organisations focus onto the individual in really quite an adverse way. And it's really great to hear a mainstream politician talking about this. So whether you agree with the politics or not, we're not discussing that, but we're talking about scientific points here that can be validated. Now, Mr. Kennedy actually said he can make a dramatic improvement in a couple of years to the health of Americans, and if we follow the example, the whole world, and also he can make even bigger changes within 4 years. And we did actually look at some material in the last video about particular conditions and particular lifestyle factors, and we considered that while this is not entirely feasible, we can't revolutionise the health of a country in 2 years or 4 years, we can make a massive amount of difference. We can facilitate change and make a huge difference. And many conditions that people are suffering from are reversible. And there is great advantage to lifestyle change at virtually any stage in a potential pathological disease process. So we really need to start taking much more responsibility for our own health. But it's really difficult when we have all these influences bombarding us saying, eat this ultra-processed food or take this potentially iatrogenic medical intervention. We need this combined effect of empowering the individual, but making it easier by changing the environment so that they're not pressurised. Individuals aren't pressurised to make decisions which might be convenient and give gratification in the short term, but have really quite significant deleterious medium, longer term, and to be quite honest, even short term problems of health. I mean, for example, we're going to hear in this video that 30% of teenagers in the United States now have pre-diabetes. This is just absolutely preposterous situation. I mean, this is going to impact those young people's lives in dramatic ways and shorten those lives really quite dramatically. 20% of teenagers in the States have fatty liver disease. So fat accumulates in the liver cells when there's more fat produced than is exported from the cells, and the liver becomes fatty. And over time that will damage the liver, and fatty liver disease is associated with a whole range of other metabolic diseases. I mean, when I was young, we only used to see this in alcoholics, basically. Virtually didn't happen in anyone else. Now it's quite common due to primarily preposterously large sugar intakes. And we'll also hear that 80% of adults in the United States, 80% are obese or overweight. And the United Kingdom is also pretty bad. So let's just focus on some of these points. I'm not going to play the whole speech because it's not too long, but we'll play a few of the relevant parts that are really quite powerful. And then we'll probably reflect on it at the end. So just a few clips now.
Feel a moral obligation to use this opportunity to save millions of American children above all things.
Well, again, talking about millions does seem like hyperbole, overstating the case. But if you think about the percentages that we're talking about and the number of young people in the United States, then these figures do become quite reasonable. And of course, when we extrapolate that to the whole world, they're more than reasonable. And the reason I agree with this is that if we carry on as we are, this health time bomb is essentially going to go off. We have to change the way things are happening now. The status quo is not acceptable. If we have the status quo, the conveyor belt of ill health is going to result in lots of pathology and lots of premature death. We need to change things to prevent these millions of deaths.
This is an issue that affects all of us far more directly and urgently than any culture war issue and all the other issues that we obsess on and that are tearing apart our country. This is the most important issue. Therefore, it has the potential to bring us together. So let me share a little bit about why I believe it's so urgent. Today, two-thirds, we spend more on healthcare than any country on earth, twice what they pay in Europe. And yet we have the worst health outcomes of any nation in the world. We're about 79th in health outcomes behind Costa Rica and Nicaragua and Mongolia and other countries. Nobody has a chronic disease burden like we have. And during a COVID epidemic, we had the highest body count of any country in the world. We had 16% of the COVID deaths, and we only have 4.2% of the world's population. And CDC says that's because we are the sickest people on earth. We have the highest chronic disease rate on earth. And the average American who died from COVID had 3.8 chronic diseases. So these were people who had immune system collapse, who had mitochondrial dysfunction. And no other country has anything like this. Two-thirds of American adults and children suffer from chronic health issues. 50 years ago, that number was less than 1%. So we've gone from 1% to 66%. In America, 74% of Americans are now overweight or obese, and 50% of our children. 120 years ago, when somebody was obese, they were sent to the circus. There were case reports done about them. Obesity was almost unknown. In Japan, the childhood obesity rate is 3%, compared to 50% here. Half of Americans have pre-diabetes or type 2 diabetes. When my uncle was president and I was a boy, juvenile diabetes was effectively non-existent. A typical pediatrician would see one case of diabetes during his entire career, a 40 or 50-year career. Today, 1 out of every 3 kids who walks through his office door is diabetic or pre-diabetic. And the mitochondrial disorder that caused diabetes also causing Alzheimer's, which is now classified as diabetes. And it's costing this country more than our military budget every year.
Well, isn't the sheer inefficiency there interesting? So America's the first in spending on healthcare and the 79th in terms of healthcare outcomes. And COVID was a real wake-up call, wasn't it? Because the average person that died of COVID had 3.8 chronic conditions, so hypertension, obesity, dyslipidemia, whatever the chronic condition was, chronic obstructive pulmonary disease, many conditions diabetes, many conditions related to ongoing ill health. And 1% of Americans had a chronic disease 50 years ago when JFK was president, Robert Kennedy's uncle. 66% now. This has changed so dramatically within a lifetime. Obesity rates in children in Japan are 3%, which is bad enough. In America, it's 50%. And the United Kingdom's not that far behind. We're not doing that well either. Diabetes, paediatricians would never see type 2 diabetes 50 years ago. Now it's quite common, diabetes and pre-diabetes. Now, of course, there's always been some type 1 diabetics. So we're talking about type 2 diabetes here. Type 1 diabetes is separate. Children do get that for another set of reasons that we could talk about, but sometimes it just happens. We're talking about preventable type 2 diabetes here. Let's go on.
There's been an explosion of neurological illnesses that I never saw as a kid: ADD, ADHD, speech delay, language delay, Tourette's syndrome, narcolepsy, ASD, Asperger's, autism. In the year 2000, the autism rate was 1 in 1,500. Now autism rates in kids are 1 in 36, according to CDC nationally. Nobody's talking about this. 1 in every 22 kids in California has autism. And this is a crisis that 77% of our kids are too disabled to serve in the United States military. What is happening to our country? And why isn't this in the headlines every single day? There's nobody else in the world that is experiencing this. This is only happening in America. about 18%. And by the way, you know, there has been no change in diagnosis, which the industry sometimes like to say. There has been no change in screening. This is a change in incidence. In my generation, 70-year-old men, the autism rates are about 1 in 10,000. In my kids' generation, 1 in 34. I'll repeat, in California, 1 in 22. Why are we letting this happen? Why are we allowing this to happen to our children? These are the most precious assets that we have in this country. How can we let this happen to them?
Yeah, neurological, brain, behavioural diseases, depression and anxiety. But he mentioned ADHD, attention deficit hyperactivity disorder, Tourette's syndrome, where you have these tics and sometimes explosive words that come out. It's kind of in the borderline really between psychological and neurological, probably more on the neurological side. Delays in learning and autism. So 70 years ago, 60, 70 years ago, 1 in 10,000. In the year 2000, 1 in 1,500. Now up to 1 in 36 and 1 in 22 in California. An explosion in the amount of autism. And he's careful, pains to add that this is not due to a change in the diagnostic criteria. This is a genuine increase. What is affecting brains, which is essentially what it means, of young people? We need to find out. And the majority, 77%, not fit for military service. Absolutely quite incredible. And yet the media, the mainstream media, just isn't talking about this. It's left to people like me to talk about this and other advocates, of course. But, you know, we're not getting this on the mainstream media. We're not getting this from mainstream politicians on either side of the pond. And one really has to wonder, why not? Why are politicians not representing and advocating for the health of the people they purport to advocate for and represent? Let's go on.
About 18% of American teens now have fatty liver disease. That's like 1 out of every 5. That disease, when I was a kid, only affected late-stage alcoholics who were elderly. Cancer rates are skyrocketing in the young and the old. Young adult cancers are up 79%. 1 in 4 American women is on antidepressant medication. 40% of teens have a mental health diagnosis. And 15% of high schoolers are on Adderall, and 500,000 children on SSRIs. So what's causing this suffering? I'll name 2 culprits. First, and the worst, is ultra-processed food. About 70% of American children's diet is ultra-processed. That means industrial manufactured in a factory. These foods consist primarily of processed sugar, ultra-processed grains, and seed oils. Laboratory scientists who many of them formerly worked for the cigarette industry, which purchased all the big food companies in the 1970s and 80s, deployed thousands of scientists to figure out chemicals, new chemicals, to make the food more addictive. And these ingredients didn't exist 100 years ago. Humans aren't biologically adapted to eat them. Hundreds of these chemicals are now banned in Europe, but ubiquitous in American processed foods. The second culprit is toxic chemicals in our food, in our medicine, in our environment. Pesticides, food additives, pharmaceutical drugs, and toxic waste permeate every cell of our bodies. The assault on our children's cells and hormones is unrelenting. To name just one problem, many of these chemicals increase estrogen because young children are ingesting so many of these hormone disruptors. America's puberty rate is now occurring at age 10 to 13, which is 6 years earlier than girls were reaching puberty in 1900. Our country has the earliest puberty rates of any continent on the earth. And no, this isn't because of better nutrition. This is not normal. Breast cancer is also estrogen driven, and it now strikes 1 in 8 women. We are mass poisoning all of our children and our adults. Considering the grievous human cause of this tragic epidemic of chronic disease, it seems almost crass to mention the damage it does to our economy. But I'll say, it is crippling the nation's finances. When my uncle was president, our country spent $0 on chronic disease. Today, government health care spending is almost all for chronic disease. And it's double the military budget. And it is the fastest growing budget item in the federal budget. And chronic disease costs more to the economy as a whole, costs at least $4 trillion, 5 times our military budget. And that's a 20% drag on everything we do and everything we aspire to. Poor and minority communities suffer disproportionately. People who worry about DEI or about bigotry of any kind, this dwarfs anything. We are poisoning the poor. We are systematically poisoning minorities across this country. Industry lobbyists have made sure that most of the food stamp lunch program, about 70% of food stamps and about 70 or 77% of school lunches are processed foods. There's no vegetables. There's nothing that you would want to eat. We are just poisoning the poor citizens, and that's why they have the highest chronic disease burden of anybody, any demographic in our country, and the highest in the world. The same food industry lobbied to make sure that nearly all agricultural subsidies go to commodity crops that are the feedstock of processed food industry. These policies are destroying small farms, and they're destroying our soils.
Well, it just goes on, doesn't it? An epidemic of fatty liver disease and all the consequences of that. More cancers, and some more unusual cancers that we used to virtually never see. Depression, mental health conditions. And you really have to wonder sometimes that are some mental health conditions and some mental health medications leading to appalling tragedies that we sometimes see related to outbreaks of violence in the United States with mass murders. Really have to ask that question there, because these ideas are coming from the mind of the murderers. It's a question we really need to be asking. And then he talks about the causes, ultra-processed foods, of course. And there were people moving from the tobacco addictive industry to make foods addictive. Now, some might consider this unethical, me, for example. Hundreds of chemicals that are in food, especially in the United States, many of which make it addictive. Food should be grown in fields and farms, not in factories, as a general principle. Not always true, but nearly always true. Environmental toxins, pesticides, herbicides, over-medication, polypharmacy. Medications, of course, from the doctors are massively important sometimes. But are we over-medicating is a pretty short debate, really, in the United States and the United Kingdom. And estrogens, largely from environmental toxins. But estrogens, early puberty and massive consequences of that. Young people are becoming adults at a much earlier stage of life. And again, you have to kind of think out loud, really, because the hormonal changes, you know, that when a baby is born, most of the brain cells are developed, but they carry on dividing new brain cells up until they're about 20. And of course, things that determine things like your gender identity. I know I'm male because I've been subject to male hormones all my life, and that's formed my brain into a man's brain. If you disrupt that hormonal equilibrium when the brain is developing, who knows what could happen? We need to massively err on the side of caution on this one. And of course, the financial implications, and again, poor people very often suffer the most because they have the least choice. I think we'll just play one more section and then we'll probably leave it for today.
We give about, I think, 8 times as much in subsidies to tobacco than we do to fruits and vegetables. It makes no sense. If we want a healthy country, the good news is that we can change all this. We can change it very, very quickly. America can get healthy again. To do that, we need to do 3 things. First, we need to root out the corruption in our health agencies. Second, we need to change incentives in our healthcare system. And third, we need to inspire Americans to get healthy again. 80% of NIH grants go to people who have conflicts of interest. These are the people, virtually everybody who sits, Joe Biden just appointed a new panel to NIH to decide the food recommendations. And they're all people who are from the industry. They're all people who are from the processed food companies. They're deciding what Americans, here is healthy. And the recommendations on the food pyramid and what goes to our school lunch programs, what go to the program, the Swiss program, the food stamp programs. They're all corrupted and conflicted individuals. These agencies, the FDA, USDA, and CDC, all of them are controlled by giant for-profit corporations. 75% of the FDA's funding doesn't come from taxpayer, it comes from pharma. And pharma executives and consultants and lobbyists cycle in and out of these agencies. With President Trump's backing, I'm going to change that. We're going to staff these agencies with honest scientists and doctors who are free from industry funding. We're going to make sure the decisions of consumers, doctors, and patients are informed by unbiased science. A sick child is the best thing for the pharmaceutical industry. When American children or adults get sick with a chronic condition, they're put on medication for their entire life. Imagine what will happen when Medicare starts paying for Ozempic, which costs $1,500 a month, and it's being recommended for children as young as 6, all for a condition, obesity, that is completely preventable and barely even existed 100 years ago. And 74% of Americans are obese. The cost, if all of them took their Ozempic prescription, is $3 trillion a year. This is a drug that is made by Novo Nordisk, the biggest company in Europe. It's a Danish company, and the Danish government does not recommend it. It recommends change in diet to treat obesity and exercise. And in our country, the recommendation now is for Ozempic to children at age 6. Novo Nordisk, the biggest company in Europe, and virtually its entire value is based upon its projections of what it's going to sell, of the Ozempic it's going to sell to America. And we have the food lobbyists have a bill in front of Congress today that is backed by the White House, backed by Vice President Harris and President Biden, to allow this to happen. This $3 trillion cost that is going to bankrupt our country. For a fraction of that amount, we could buy organic food for every American family, 3 meals a day, and eliminate diabetes altogether. We're going to bring healthy food back to school lunches. We're going to stop subsidizing the worst foods with our agricultural subsidies. We're going to get toxic chemicals out of our food. We're going to reform the entire food system. And for that, we need new leadership in Washington. Because unfortunately, both the Democrats and the Republican parties are in cahoots with the big food producers, Big Pharma and Big Ag, which are among the DNC's major donors. Vice President Harris has expressed no interest in addressing this issue. 4 more years of Democratic rule will complete the consolidation of corporate and neocon power, and our children will be the ones who suffer most. I got involved with chronic disease 20 years ago, not because I chose to or wanted to. It was essentially thrust upon me. It was an issue that should have been central to the environmental movement. I was a central leader at that time. but it was widely ignored by all the institutions, including the NGOs, who should have been protecting our kids against toxins. It was an orphaned issue, and I had a weakness for orphans. I watched generations of children get sicker and sicker. I had 11 siblings, and I had 7 kids myself. I was conscious of what was happening in their classrooms and to their friends, and I watched these sick kids, these damaged kids. In that generation, almost all of them are damaged. And nobody in power seemed to care or to even notice. For 19 years.
Well, I think we'll leave Mr. Kennedy there, but rooting out corruption, absolutely essential. Changing incentives, inspiring people, getting rid of the conflicts of interest. And don't think we're squeaky clean in the UK. I mean, for example, we talked to Professor Angus Dalgleish, who's got a new treatment for cancers. It doesn't involve drugs, it just involves bacterial preparation. He's keeping his cancer patients alive. It could potentially prevent cancers and prevent a lot of infections. And doctors could prescribe this compassionately if it wasn't for the fact that the Medicines and Healthcare Products Regulatory Agency have refused him permission to, refused him a license for it. I mean, why would they do that? Why would they do that? Why not allow doctors to make the decision? Regulators funded by for-profit industry. Sick child's actually a really good idea, because a sick child could need medication for the next 80 years. Every day. Think of all the money that comes in. Why not just buy food, make people healthy, rather than spend trillions on artificial treatments? In fact, why don't we bring back common sense? Why don't we do that? Quite a long video today, but very powerful points. I think you agree. But for now, thank you for watching.